Good afternoon and welcome again to the members of the press who are on the line, and thanks again for taking the time to listen to this briefing by the Pan American Health Organization. Today I will focus on two issues. Firstly, an update on the Influenza A H1N1 vaccines, and then secondly, the public health implications for disease surveillance. As expected, the H1N1 virus is spreading south to more countries. We estimate that the Americas report greater than 4,700 cases as we speak and are coming from 30 countries. A total of 54 deaths have occurred, 48 in Mexico, 4 in the USA, 1 in Canada, and 1 in Costa Rica. We are dealing with a new disease caused by a new virus that no one has ever seen before. Therefore, humans have no prior protection against this virus. They have no immunity, and we just don't know what's going to happen. One very positive development is the number of institutions advancing rapidly on the vaccine front. WHO collaborating centers at the CDC in Atlanta and the National Institute of Biological Standards and Control in the United Kingdom are among a half dozen or so more laboratories that are developing candidate vaccine viruses using reverse genetic technology. And 2 of these expect to have their candidate viruses by the end of this month. At least 3 other laboratories are working on vaccine virus candidates, and 4 others are developing vaccine potency reagents for testing. In addition, the wild virus has been sent directly to about 10 manufacturers for use in developing the necessary vaccines. As I have said before, this rapid progress means that we may have an H1N1 vaccine available within the next 6 months. Meanwhile, we need to remain focused on what we can do as individuals and what our society as a whole can do to protect our individual actions. From an individual standpoint, I need to ask myself, what can I do to protect myself and my family against this virus? The main route of transmission of the new Influenza H1N1 virus is via droplets, and those droplets can be expelled when I sneeze or cough, when I touch my mouth, turn the handle of the door. These are mechanisms by which the virus can spread. You can prevent getting infected by avoiding close contact with individuals who show influenza-like symptoms, by trying to maintain a distance at least 1 meter, if possible, and taking the following measures. Avoid touching your mouth and nose, clean hands thoroughly and frequently with soap and water. You can also use an alcohol-based solution, a hand rub on a regular basis. Reduce the time spent in crowded settings if possible, and improve the airflow in your living space by opening your windows. Practice good public health habits such as adequate sleep, eating nutritious food, and keeping physically active. So what can society do? What can our communities do? What can our ministries of health with the public health infrastructure do to help us control this outbreak? With the new disease, we need the best information to be able to understand it, and therefore take measures that will ensure the most effective outbreak response. In the early phase of the epidemic, when countries try to combat these new cases, they try containment strategies, such as closing of schools and restricting attendance to large mass gatherings or public events. These strategies may help slow down transmission, may help slow down the spread of the outbreak, and that's good. We want to avoid overwhelming the health system. We are learning that these measures may be very helpful during the initial phases, particularly if the first cases are in a confined area, such as small town or village, or in a school. Eventually, though, transmission spreads, and such measures are less effective, if at all, during the later phases of the outbreak. By far, one of the most important things we can do is implement effective surveillance so we can monitor trends and better understand risk factors. Effective surveillance will help us identify people who have a more severe form of the disease so they can receive the life-saving attention and treatments in a more timely fashion and thereby prevent death. We have learned that the deaths in Mexico have occurred generally in two groups. One group includes people with chronic diseases, and the other group includes young, healthy adults between the ages of 20 and 40 years of age. The first group makes sense. We know with chronic disease, this imposes well-known risk factors for complications when the individual is stressed with an acute infection. We have learned about the second group is that these folks tended to reach the facilities for health care late, and therefore they received the necessary medical attention and treatments late, and this put their life at risk. So, enhanced surveillance should help us prevent unnecessary deaths in countries newly reporting cases, particularly in the Southern Hemisphere. PAHO and CDC are working hard to ensure that as many accurate test kits are getting to all countries. And as I speak now, virtually all countries have received these kits. We are discussing plans, though, to sustain this type of support over the long haul. What is going to happen? We just don't know. So that is why it's vitally important that all measures address the long-term as well as the short-term implications of understanding and controlling this outbreak. Please refer to our materials on our website at PAHO and WHO, and I'll stop there to entertain any questions that you may have.
Thank you, Dr. Andrus. We have some questions online, and we also have Televisa here as well. So since you took the trouble to come, we'll give you first crack to see if you have any questions for Dr. Andrus.
Thank you. Doctor, I would like to ask you in Spanish if it's possible. Recently, we have seen, as you mentioned, another people dying from this disease in the U.S. Do you find, encuentra usted alguna similitud entre las características de esta persona o de las que han muerto en Texas y las que han muerto en México?
Sí, la muerte en Texas ocurrió en una mujer que fue embarazada y después de nació ella murió, y sabemos que ella tiene una enfermedad crónica también. Son dos factores de riesgo, y aprendimos hoy una muerte del estado de Washington. Ocurrió en un hombre que tiene enfermedad crónica de su cardia, entonces chronic heart disease. Entonces estos son factores de riesgo para esta infección.
Y puedo seguir. ¿Ustedes esperan que el curso que sigue esta enfermedad en el sur del hemisferio pueda ser más similar a lo que ocurrió en México que a lo que ocurrió en Estados Unidos? Y por otra parte quisiera preguntarle qué importancia sigue teniendo el trabajo que realiza la Organización Mundial de la Salud con el CDC y la PAHO en México.
Si yo entiendo bien su pregunta, los nuevos casos en los países del sur son casos con una historia en el gran mayoría de los casos, una historia de viajes a Estados Unidos o México. El segundo parte de su pregunta fue sobre el apoyo de CDC y OPS a México. hay un equipo grande, creo que casi 30 expertos que están trabajando con sus colegas en el Ministerio de Salud México. Hay un gran trabajo también que yo mencioné en mi presentación sobre el hecho de estos cajas de investigación con los reactivos para hacer los estudios en el laboratorio. Es un trabajo de CDC en colaboración con OPS. Gracias.
Gracias, Dr. Andrus. Creo que tenemos una pregunta por teléfono, nos dijo Harry. Can the questioner on the phone go ahead with his question, please?
We do have a question from the line of Alan Miranda with Excelsior. Please proceed with your question.
Hi. Thanks for taking my question. What I would like to ask is whether the World Health Organization and the Pan American Health Organization are currently considering sending any teams, any help, material help to Argentina to cope with this problem, because they are already dealing with dengue. I don't know, perhaps I'm guessing that their health system could be overwhelmed. So are you planning on to send any help, any additional help?
I think we're doing everything we can. Your question is in reference to Argentina. I know the strategy to date has been to target countries with fewest resources. So we have sent teams to countries, for example, the sub-region of Central America, and they will be covering those countries such as Nicaragua and Honduras and Guatemala, Dominican Republic, nearby countries that have fewer resources. The same has been discussed for the countries of South America, targeting Bolivia and Ecuador. But your mentioning Argentina does not preclude us from trying to reassess our capacity to provide support, in addition to what I mentioned, the test kits, the information that's been put on the web, and the daily communications that we have. So if the situation demands, I am sure PAHO will do whatever it can, even in the case of Argentina, to help control the outbreak.
Okay. Thanks, Doctor. Thanks, Dr. Andrus. Now we have one from Maria Guimaraes from Pesquisa, and she's asking, researchers have now sequenced the H1N1 RNA. How does this help, if at all, in predicting the possibility of an outbreak and developing vaccines or medication?
Well, for the development of vaccines, it's absolutely critical. You need to know the genetic sequence of the genome in order to develop an antigen that would be used in a vaccine to provide the necessary immunity. So when we talk about seed strains for vaccine, to the extent possible that strain that goes into the vaccine, that in most cases is killed, it should match what's causing the outbreak. So it's absolutely critical is the answer to that question. Knowing the molecular epidemiology of these viruses is also very important for monitoring transmission of the virus and making inferences about the genetic information we know and what we see in the outbreak, the rapidity of the spread, severity, and so on. These are ongoing activities related to research that will help us better understand the nature of transmission for this virus. And having said that, there has been a lot of work. The term that some people use is archaeologic epidemiology, going back in history and trying to piece together that information to be able to tell the story better on what may have occurred in the past.
Thanks, Dr. Andrus. We now have a question from Brian Horvath in Ottawa, Ontario, who says, as the H1N1 virus spreads around the globe, like in South America, there are many areas that have smaller communities that either raise boar and have wild boar or animals that are related to pigs in the area. What are the possible impacts this might have in terms of the virus mutating as it comes into animals that are not farm-raised pigs that you see in large-scale commercial farms, but are in and around the community and yet are in the swine family?
It's a very good question, but it's a question very difficult to answer because it's almost impossible to predict the behavior of this virus, where it's going to go, which humans it's going to affect, which animals. We do know there is the experience from the 1918 flu outbreak where that H1N1 strain died out in transmission and then re-entered the pig population and has been circulating over the years, never to come back to the humans. So these things can happen, almost exponential variations of the theme of what could be possibilities, and just very difficult to predict.
Thanks. Now we have El Universal, Doris, asking a question. She said, Dr. Andrus, you said virus is moving fast in the southern hemisphere. How many southern hemisphere countries are interested in getting a new vaccine against AH1N1? And how many are not interested in getting the seasonal flu vaccine, and which are?
The data, that's another very good question. The data I have at hand show that 35 countries of Latin America and the Caribbean are using seasonal vaccine in their programs. I do not have on hand the very few number of countries that are currently not doing that. I don't remember, and I didn't bring that data with me, but there would just be a few. I would say that virtually all countries are interested. The nice thing that historically has occurred in Latin America and the Caribbean is the tremendous political commitment to the use of preventive medicine strategies such as vaccination. And the power of prevention has been a tradition. We often refer to it as a culture of prevention. It's been a tradition to eradicate polio, eliminate measles and rubella. We see this every year with our vaccination week in the Americas. There's a lot of commitment and demand for the use of these vaccines, and to the extent that most countries consider vaccine as a public good, much like you would have a lighthouse on the coast to protect all ships. Vaccines are to protect all children, and it's a child right, it's a people's right to have these kinds of preventive measures.
Okay, thanks, Dr. Andrus. We now have a question from El Nacional in Venezuela, Carolina Conde Ribeira, who says, ¿cómo se puede evitar el reciente aumento de casos autóctonos de gripe A H1N1? ¿Cuál es el riesgo que existe de que la enfermedad siga expandiéndose?
¿Autóctonos? ¿Qué es?
Autochthonous transmission. In-country transmission.
That's a good question. It's one that comes up frequently with the staging of alertness that WHO uses, and to go from phase 5 to phase 6 requires sustained community transmission in 2 regions of the world. So then the question comes, well, what is sustained community transmission, and what's the likelihood of it happening, much like the reporter asked. And it has been said that sustained community transmission is when you have a situation where there's so many cases you cannot do the contract tracing to determine the origin of the virus. And that's what we have with seasonal influenza. Seasonal influenza comes, we know it's the high risk time of the year. If we get the vaccine and it's a good vaccine that year, then we're protected. But if we forget to take the vaccine and we come down with the flu, 99.9% of the time you just don't know where you got it. You could have received it at school or at work. So that's a condition or situation where we're calling that sustained community transmission. If, on the other hand, though, you have a situation where the virus enters a school and you know that this child was in contact with another group of children and they then in turn got infected, you have identified the chains of transmission and you know through this contact investigation the origin of the virus. Experts are not likely to call that sustained community transmission, and in the case of this alert system, we are not. So what we'd like to see in another region in order to determine we're in phase 6 or that would provide the recommendation is where a country has the introduction of the virus and then over time, like what's happened in Mexico and the United States, Canada now, when you see new cases, as we've seen just in our own community here down the street, it's unlikely that we'll ever find the source of that infection.
Thanks, Dr. Andrus. We now have Elizabeth Malkin, a reporter in the Mexico City Bureau of the New York Times, who is asking, can you explain more about the archaeological, epidemiological investigation into the origins and the early transmission of the virus? And is this presumably in Mexico and the United States?
That's a great question. I think there are some of the world's best experts currently working on that. We're here at PAHO focused on what we can do today and looking forward to trying to help countries control this outbreak. I think it will take time for these global experts to collect enough information to tell the story. And so the book is still open. I'm not an expert in these kinds of studies. I know they're ongoing and underway, and perhaps in the next months or so we'll have much more information to describe the history of events. It's fascinating, but we just don't have the time at the moment working around the clock trying to help countries control the outbreak.
Okay, thanks, Dr. Andrus. And then I understand we have one more question via the telephone in English. Go ahead with your question, please.
Our question comes from the line of Alan Miranda with Excellior. Please proceed with your question.
Hi, I would like to for you to elaborate on the part about the region. Do you believe that the current classification of North America and South America being being considered as the same region by the World Health Organization, does adequately treat the needs of both parts? I mean, do you believe that the fact that there are sustained cases in North and South America, well, in case there were, would actually be helpful to understand? Well, sorry, I'm mixing up. Let me restate that. Do you believe that the fact that North and South America are treated as the same region is adequate?
That's a very good question. As I was thinking through your question as you were speaking, I think it's a very good question, and it's a nice chance to describe very briefly about the history of the Pan American Health Organization. It was started, it's by the way, the oldest international health organization in the world. It was founded in 1902 in response to the cholera outbreaks that were occurring at that time. I should say yellow fever outbreaks. I'm sorry, it was not cholera outbreaks, but the cholera was occurring. But the response to the formation of the Pan American Health Organization was the response to the yellow fever concern. And this is a disease that we know has a very high case fatality rate. In an outbreak situation, that case fatality rate can be as high as 40%. So nearly half, almost 40% is not far off to half of the people dying who get the disease. So it was quite a concern in those days, and it was decided why not bring the countries together and work on this problem together, recognizing that the countries that were more affluent could be helping the countries most in need. And that was the idea behind the Pan American Health Organization, and that subsequently led to the Pan-Americanism and solidarity, I think, that exists when we have crises like this. But what you raise is a very important consideration, because one size does not fit all, and this is the Western Hemisphere. That's a huge landmass with a lot of variance in cultures, communities, level of resources. So what PAHO has done is taken a sub-regional approach to prioritize support. I mentioned Central America. We have a targeted response to the country of Central America who are most in need. We have a sub-regional office in the Caribbean, because they have situations, problems, and priorities that might be different from the countries of Central America or the Southern Cone. And so we do take a sub-regional approach to account for exactly what you raised in your concern.
Thank you, Dr. Andrus. I think we have no more questions on the phone or on the Illuminate line, so we would give Televisa last chance.
Yo quisiera preguntarle, ¿usted considera que la Organización Mundial de la Salud actuó adecuadamente en respuesta a esta epidemia? Porque hubo algún reporte de médicos mexicanos que aparentemente reportaron la enfermedad y dicen que la OMS tardó demasiado tiempo en implementar medidas de emergencia.
Gracias para su pregunta, pero en la información que tenemos, creo que la respuesta de la organización OMS y OPS fue extraordinario en términos de el apoyo que fue pedido del gobierno de México. Y hubo una, ¿cómo se dice?, una encuesta en la Ciudad de México pidiendo personas, en su opinión, cuál es el estatus de apoyo de OMS, cuál es el estatus de apoyo del presidente, de mayor de México y otros liderazgos de México. Creo que fue bien. Creo que la persona promedio en México, en mi opinión, que yo estoy leyendo cada día, es una presión de bien sentido en términos de la respuesta grande de las organizaciones y el gobierno de México.
Por otra parte, ¿usted considera que en Estados Unidos dejó de prestarse la atención suficiente a esta enfermedad? Vimos que en solo una semana la prensa norteamericana difundió más de 25,000 historias escritas sobre este tema, cuando había pánico, temor, incertidumbre. Ahora ya muy poco se menciona en los medios. ¿Esto puede contribuir a que en Estados Unidos se baje la guardia y no haya suficiente información para detener el avance de esta enfermedad?
Una pregunta muy, muy interesante, porque como mencioné, este virus va a viajar al sur, y creo que el apoyo de comunicación de Estados Unidos va a ayudar la comunicación de todos los países. Es una comunicación de, al fin del día, cada persona debe saber muy, muy bien las cosas que yo puedo hacer a proteger yo y mi familia. Entonces, de varios caminos, la comunicación e información buena, no información de histérica, pero buena comunicación, con una balanza de riesgo, una balanza de atención y focus, creo que puede ayudarnos con esta enfermedad.
¿Pero usted cree que en este momento se está dando esta información? Porque usted ahora abre un periódico y ya no hay tanta información.
Hay menos.
Y ve la televisión y tampoco.
Es una preocupación, pero yo entiendo.
¿Y qué es lo que sigue ahora, doctor? Se dice que ya se estabilizó la enfermedad en México y en Estados Unidos. Pero, ¿qué sigue ahora? ¿Qué riesgo hay de que se agudice o qué posibilidades hay de que se controle y se erradique?
Primero, no es posible erradicar esta enfermedad porque tiene tiene otro animal donde la transmisión puede continuar. Pero el riesgo es bajar nuestras manos y para no tener la vigilancia a monitorar qué está haciendo este virus. Durante los meses de verano en Estados Unidos sabemos que el nivel de casos va a disminuir, pero cuando septiembre, octubre vienen, los casos van a mejorar. Entonces necesitamos continuar la vigilancia. Por eso yo mencioné la importancia de vigilancia. Gracias.
Bueno, muchas gracias a todos. Thank you very much. That ends today's briefing.